Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Well, Tracy, it is August, as you well know, around your household. And in the next few weeks, the kids are going to be going back to school all across the United States.
Not that I'm keeping track at all.
Now, while some kids may be excited, to go back to school, and others might be a little nervous or a little apprehensive. And one thing that's worth talking about at this time of year is the importance of good hygiene habits. You know what kids can do from getting sick during the year? And it's similar to the things that we do in the hospital to keep ourselves from getting sick and keep from spreading disease among the other patients.
Here to discuss getting ready to go back to school is Mayo Clinic pediatrician Dr. Bob Jacobson. Welcome back to the program, Dr. Jacobson.
I'm glad to be here. Thanks for having me.
So, Dr. Bob Jacobson, it's always great to have you on the program. And I suspect this is a pretty busy time of year for you, with parents bringing their kids in for a little tune-up before school.
Yes, it's a time when parents, one, because of summer, have the kids at home and have more of a schedule to make those visits, but also have the pressure to get forms filled out for sports and to catch up on vaccines that might have been let go for the last years. And it's now time to get those 11 and 12-year-old shots in, or the preschool shots. It's also a time for parents to think about, with the excitement of school, the new clothes, the books and papers, and getting ready to meet the teacher, for them to consider a few other things that they can take advantage of the new year. And it is a sense of a new year, and it is exciting, and the parents can build on that to create new habits for their children, or to restore habits that have gone badly over the summer, such as getting a good night's sleep. A lot of children who struggle with stress and anxiety can really benefit from well-established sleep habits that the parents really should be taking over in August and not waiting until September or later. So now's the time to set a good wake-up time that's expected of the children, and to figure out how many hours of sleep they need at night, so they're waking up just as the alarm clock's going off and not needing to be dragged out of bed. Children often need 10 to 12 hours of sleep, and parents so frequently give up on the rules in the summertime for so many reasons. But now's a good time to say, no, we're going to reestablish our bedtimes, and we're going to work on it as a family. We're going to get the meal done. We're going to get our play out of the way, and we'll wind down and have the last hour, TVs, phones, and internet off, phones away, and use the last hour to just get ready for sleep and stick to a schedule for a week or two, ready for the school year.
Phones away, that's heresy.
Sounds good to me.
So do you see a fair number of parents who bring their kids in because they're apprehensive about going to school? I mean, I remember, I don't know about you, Tracy, but our daughter was fine. Girls, they like school. But
each kid is different, that's for sure.
Our son was not only apprehensive about going to kindergarten, he refused to go.
Oh, boy.
I mean, why would you go to school when you could be at home and your mom takes care of you all day and do whatever you want? But is this a problem for some parents?
It really varies from child to child. So a family of 3 children can think that they've got it down with the first 2 and then be surprised by the third one who has real troubles. And parents may not see it at first. It may not show up in that first week of school. But as assignments start getting assigned, as children start differentiating themselves, making friends or not, children can start struggling with abdominal pain that might keep them out of school, and that might build into a cycle of using pain to avoid Mondays. And parents really need to watch. Because for the most part, children should learn to go to school even when they have aches and pains, a little bit of the sniffles or their allergies are flaring up. Those aren't real reasons to stay home. If the abdominal pain is so severe that the child's not eating and can't really move, they should be in an emergency room, not at home in bed. When it's a dull ache of anxiety or discomfort, the parent really should be talking them through that and explaining how it's important to learn how to get through your day even when you have a belly pain or a headache. And that's where a parent can be helpful with firm rules about school attendance, as well as saying, if there are things at school that are bothering you, let's talk about it. But let's not just make it so that you can't go to school.
So what do you tell parents? How do you help the parents guide the child and help them get over their nervousness and their apprehension about school?
I think the first thing is pick a non-threatening time of the day such as the end of the day, the afternoon, the weekend, to talk about those things rather than right before going to school. That's not a great time to have a discussion. The child's already apprehensive. What the parent needs to say, you know what, I want you to make the best of it. I want you to get on that bus. I want you to get to school. We'll talk about the end of the day. Let's make a special date, you and me at the table, just the two of us, and find out what you have to tell me. But I want you to make an effort. Now, if this is persisting day after day, week after week, it's time to call up the teacher and find out what the teacher's observing. And get the teacher's help. Maybe a one-on-one meeting with the parent and teacher can really help clarify some issues. You know, we really encourage parents to think about contacting the pediatrician or family physician when they're having these concerns that are persisting. We can get a therapist who might visit with the child 1, 2, or 3 times. Nothing like long-term therapy, but just a few visits to help the child meet with someone outside of the home and sort of get some bearings and some logical discussion about what they're seeing and not seeing and what they're thinking and not thinking. And that can often help a parent move forward with a child who's struggling.
The mental health aspect of back to school, and certainly something that we never, any of the three of us when we were going to school, never had to have conversations about was bullying. Although now you know better, you do better, hopefully is what's happening. What if kids are remembering, I didn't have such a great experience last year, and so they're starting to feel a little trepidatious about going back to school this year?
Well, I remember as a child, the old advice from your teacher or from your parent was, if you didn't run away, they couldn't chase you. And I think a fair amount of bullying was tolerated. And teachers turned away from it. Principals didn't enforce rules regarding it, and parents just gave up and thought it was the victim's fault or part of growing up, and they had to go through the same thing. We now realize that the bullying can be so harmful that can lead to school absences and school failures. It can lead to changed visions of what a person can or can't do with their life. And so we've got to take it seriously and have a zero tolerance policy to the action and behavior. Frequently, the child who's bullying needs just as much help as the child being bullied. And frankly, turning a blind eye to it is leaving two people to suffer, maybe differently, but we've got to really work on it. So our policy as parents, teachers, and physicians should be, this is unacceptable. We've got to get adults involved, and adults have to take care of things.
And do you think the school is doing a pretty good job of keeping kids from bullying or helping the parents in that?
I think it depends on the teachers and the principals at the individual school, and they need the parents' help to bring these things to light. And the parent needs to recognize when a teacher is over his head or over her head and needs the principal involved. I think for the most part, we're very fortunate to have good, strong public schooling where you can count on the principal to take this very seriously. But just as in all professions, we have young people who are entering the job market, taking on jobs where they may not have this experience of an older teacher and may not be as equipped for a particular personality or type. And that's where the parent needs to work with the school, the teacher, and with the principal, and not just throw up their hands and say nothing can be done about this.
You mentioned establishing or getting back to some good sleep habits before the summer is over. What about hygiene habits? And is now a good time to go back? Let's practice washing our hands again.
I think so. I think hand washing with soap and water is a mainstay of keeping a lot of germs away from us. And I say that knowing that the hands are the filthiest part of a person's body. It picks up other germs from other human beings and keeps them alive at body temperature until you bring them up to your eyes, nose, or mouth. Parents should demonstrate great hand washing habits. They should say things like, I'm going to go wash my hands with soap and water before I get things out of the refrigerator for lunch or for breakfast or for the meal. Or they say, okay, that was a great meal. I'll take out the garbage. I got to wash my hands now that I've taken out the garbage. And just make it clear to the child that hand washing is something that goes on through the day. I think very helpful with, making sure there's soap in the dispenser or bars of soap at the sink, that there's clean towels, and the child and parents know when their children have washed their hands or not. They can use their ESP rather than ask the child a question that only puts a child.
Let me smell your hands.
Yeah.
Only puts a child in a chance or an opportunity to lie. I would say instead, I know you didn't wash your hands. You go back in there and wash your hands, and then explain to them it's your hands that are going to bring the child next to you's germs up to your mouth, eyes, or that. So, frankly, at the end of the day, I even encourage parents at the end of daycare when they bring the child home to have them wash their hands with soap and water. And it's a good habit for parents to demonstrate and talk about. There's another type of hygiene we should talk about too. We know that parents struggle with issues of overeating and children's weight concerns and issues with body image. One very aggressive, proactive approach parents can take starting now in August is start having a family meal once a day at least, where everyone in the family sits down and eats a meal together. Oh, we dream of having 3 meals together, but that's actually for many parents a moonshot. But if they could start today saying, okay, from now on until the beginning of school, we're going to have one family meal together where we all sit down, having washed our hands, and we all sit down and have a simple meal together. And I'm not talking about buying processed foods from a fast food store. I'm talking about either having sandwiches or something made at home that the family can enjoy around the table as something that represents good nutrition and a good habit for the children to take into the school year.
All right, wash your hands and make sure you have one family meal together every day. We're talking about back to school for America's youth with Mayo Clinic pediatrician Dr. Bob Jacobson. Time for a short break, but when we come back, we're going to talk about what the criteria are that parents should use for deciding when to keep their child home, when they're too sick to go to school. And we'll give you an update on immunizations that are required before school, during school, and before you go to college.
You're listening to Mayo Clinic Radio on the Mayo Clinic News Network.
Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
We are with Mayo Clinic pediatrician Dr. Robert Jacobson, who's an expert on everything you need to know about sending your child back to school. We've talked about the importance of hygiene. We've talked about bullying, and we've talked about sleeping.
And eating together.
Yeah, we've got everything covered, except we want to ask you about the criteria that parents should use in deciding whether or not their child is too sick to go to school. What do you tell parents?
For the most part, for most illnesses and injuries, children should be going to school and not staying home. Staying home can be very disruptive to the teacher's program, the curriculum, and the child's sense of what their main job is during the school year, which is going to school and getting the work done. I would say for fevers, true fevers of 100.4 or higher, that would be indication that you're coming down with a new illness. You're at perhaps your most contagious point. And so I would say for fevers of 100.4 or higher, you should stay home. Now, I would say that if the illness has entered a convalescent stage and you're now recovering, then the child should return to school. Remember, if you're going to be sending your child back to school with Tylenol or acetaminophen to help with the aches and pains of the illnesses, it needs to go with a note, a labeled bottle that demonstrates what's in the bottle, and the child needs to get basically the school's awareness that the child has the medicine, ideally with the school nurse, so the school nurse or the school authorities can look at the child as they take the medicine and decide if the child has become too sick to stay at school, but also gets the medicine taken when and appropriately done.
Well, if their fever is so bad that they need the acetaminophen to keep the fever down, they probably shouldn't be at school.
Right. No, that's more acetaminophen for aches and pains, not
Gotcha.
for the fever. But, an illness can leave you with up to 10 to 14 days of symptoms, and we certainly don't want the child staying out that whole length of time. But if the first day is a day of school and there's a fever of 100.4 or higher, they should stay home. As the fever regresses, then the child should be back in school. Now, I'm very wary of parents who tell me, well, my child never gets a fever that high, but they have fevers of 99, and so that's when I draw the line for this child. I would argue that's wrong. We all feel warm and uncomfortable when we're coming down with illnesses, and many of us will run 97 or 97.5 and then get warm with an illness of 99, but that's no warning sign to stay home from school. Let's draw the line, and a good line would be 100.4. We know that even in the afternoon, an athletic child can run up a temp to 100.4 just from exercise. So it needs to be a sick child who has 100.4.
I don't mean to divert the attention to what we're talking about, but I have a quick question. I was just thinking the other day, there was a time when we were supposed to convert to the metric system. I notice you're using Fahrenheit. What happened to that?
Oh, we Americans just struggle.
Yeah.
But if you want to use Celsius or centigrade, it's 38 degrees.
All right, but we've given up on that, is what you're saying. All right, let's talk about immunizations. What's required in terms of immunizations to start school?
Well, in general, for a child starting kindergarten, they need to have completed their DTaP series. That's a diphtheria, tetanus, pertussis series. They need to have completed their polio series. That's the IPV or inactivated polio virus. They need to have completed 2 doses of measles, mumps, rubella, and 2 doses of the chickenpox or varicella vaccine. They also need to have completed their 4 doses of the pneumococcal conjugate vaccine, and they need to have completed their 3 doses of the hepatitis B vaccine series. So that's required. And
before you go to school.
Before you go to school. Now, we start it at birth. And so if you've been staying on top of your child's schedule, they may actually have a preschool visit, where they only need 2 injections. Now, for those who are busy households, we're talking about the 3rd or 4th child in the household. You might know more than the pediatrician or family physician stopped sticking to the well-child visit schedule. You might find yourself in trouble and needing to do some catch-up work. And we can work through the catch-up and bring your child up to speed. Our office uses a combination of nurse visits and well-child visits to bring the child up to speed, so it doesn't call for a big, difficult scheduling time. In fact, this summer, we've opened up the office and have some evening and weekend hours as well to get those vaccines in.
What about college kids or high school age kids?
Yeah, let's not skip the 11 to 12-year-olds that should be completing their their meningococcal conjugate vaccine at 11, and then again at 16 years of age. Tdap vaccine at 11 years of age, and 3 doses of the human papillomavirus vaccine by the time they're 13 years of age. We started at 9 because we know it's difficult to get in. And did I say 3?
Yeah,
that just changed
yes.
in 2017. For children who are under 15 and are starting that series, they can take advantage of them having a much more dynamic and responsive immune system. They only need 2 doses of HPV vaccine. If somehow you've been delayed and haven't started until age 15, then you're going to need 3 doses.
And then finally the college kids?
College kids are going to need another meningococcal vaccine, that 16-year-old vaccine, and many colleges will say, we're going to need the full record, we're going to need proof of measles, mumps, rubella, we're going to need evidence that you've completed the hepatitis B series. Some colleges are going to say we need that meningococcal B vaccine. Now that's a vaccine that we actually don't have as much evidence or strength for using as a routine recommendation, and so we have choice language that allows it to be offered up to the parent and child or young adult, and then they decide, knowing that the weight of the evidence for that particular vaccine is not enough to justify a routine vaccination. But many of our colleges across the land feel differently and require it.
All right, everything you wanted to know about getting your child ready to go back to school and what immunizations you need as they grow older. Mayo Clinic pediatrician, Dr. Robert Jacobson. Always great to have you on the program. Thank you.
Thank you.
Still to come on Mayo Clinic Radio, we'll discuss the warning signs of depression in children. And later on the program, getting ready for school means developing a good sleep routine. We'll talk kids and sleep with a Mayo Clinic expert.